For many families, the school day doesn't start with a backpack and a goodbye. Mornings may start with tension, getting your child awake, fed, and out the door. The worry follows you on the drive, hoping the school won't call today. Instead of feeling comforted by the routine of the day, you're bracing for what might happen next.
School avoidance is more common than many families realize. At some point, it affects an estimated 5 to 28% of young people. It might start with a missed day here or there, leaving early, or frequent complaints about going, and over time, the pattern grows. This isn't about defiance or a simple lack of motivation. Sometimes kids are trying to avoid situations that feel overwhelming. Sometimes the pressure comes from social or performance expectations. And sometimes the pull is towards safety, wanting to stay close to a parent or finding that being at home feels more manageable.
In today's episode, we're slowing things down and discussing the why behind school anxiety, refusal, or avoidance, and how to support your child when these struggles show up.
Our goal today is to help families think about school avoidance through a broader lens, not just how to get a child back into the building, but how to understand what they need to thrive. Joining us today is Adam Honecker, a licensed clinical social worker and the director of Compass Health Center's Adolescent PHP and IOP programs at our Chicago location. He's a clinician who works closely with families navigating school anxiety, avoidance, and burnout. Adam, we're really glad you're here. Tell us a little bit about yourself and your professional background.
Yeah, thanks for having me. Yeah, like you said, licensed clinical social worker. I have been in the field since 2009. I started working with kids in the foster care system, mostly doing individual and family therapy. And then I've been at Compass 12, 13 years. And that's where I first started to see and work with school anxiety. So here, day to day, I work with patients and their families and oversee the teams. And yeah, you see a ton of school anxiety and avoidance. And I think in particular, the older I've gotten, the more I like working with parents. And I know we're going to be talking about them a lot today.
Adam, I'm curious, when we're talking about school anxiety or school refusal, what do those terms actually mean?
I actually don't typically say school refusal a ton to families I'm working with because it really is more avoidance. I think refusal conjures this image of like a kid crossing their arms and holding their breath and saying, I'm not going to go kind of stuff. And usually for me, really avoidance is the anxiety or the stress going to school is so severe that a kid is literally not attending. It's not running late. It's not disorganization. It's really such overwhelming feelings that a person is not going to school and not engaging in their daily life.
Is it always someone not going at all, or does it start smaller or maybe look different from just not showing up ever to school?
No, I think it's annoying when therapists say it sort of depends, but it sort of depends. It can look like so many different things. And I think that's one of the tricky pieces is, it can be a little bit clandestine at first. Some kids can be dragging in the morning and struggling to get out the door. You're hearing about stomach aches, but there's no actual illness that you're aware of. Kids showing up late, missing certain classes. I think there's a million different ways this shows up, and I know we'll get into that. But no, it's not just like I'm not attending school. I think we see this showing up in many, many, many different ways. And obviously that complicates how you deal with it as well.
Could you walk us through the different reasons a child or teen may be avoiding school?
We talk about that a lot in program, and there's a whole assessment that is used to kind of dig into the functions of school refusal. These are things developed by Dr. Kearney and Silverman, but kind of broad strokes, we understand the four main drivers that lead to school avoidance or refusal are staying away from distressing or negative effects. Refusal allows a kid to avoid feelings of dread, panic, physical discomfort, things related to what happens in a school. So hallways, talking in class, presentations, being in a locker room, being at lunch, all the things of a school environment. And for us, we see that as really connected to anxiety. Similarly, there's missing school to avoid and escape social situations, especially those that will involve some sort of evaluation and scrutiny. So kids with social anxiety or folks with social anxiety, we see this a lot. Things like group projects, small talk, performances in front of a class, things like that. Another thing we see show up for one of the kind of reasons to miss school or to avoid school, the way it's described is kind of seeking attention, but what it really means is a young person seeking attention and connection and genuinely being with their parent. People will talk about separation anxiety, but a kid wanting to be home and be present with their family. The last umbrella term we think about is the function would be kind of gaining tangible rewards, or missing school leads to other things where, you might have time playing video games, screen time, time with friends. That's one where I think some therapists use the phrase behavioral, but where a kid is maybe engaging in other behaviors that have become more appealing, and joining in those is more rewarded than going to school.
Over your time at Compass specifically, you said you've been, at Compass for over a decade. Have you seen, the number of kids that are showing up for help with school refusal increasing? Is it decreasing? What's the current climate for school anxiety right now?
I think it's been pretty persistent. I think it's been an ever-present concern. Obviously, over COVID and after COVID, things looked a little bit different. But no, realistically, it's looked very, very similar from my time. I would say kind of the approach to the work has shifted a little bit. And I think we've hopefully all professionally gotten better at it. We're doing a lot more exposure therapy, and I think finding better ways to work with it. But I've not seen this marked increase one way or the other. I think parents appear to have more information and understanding about it than, say, maybe 10 years ago. I think I talked to a lot of parents who will say things like, it wasn't an option when I was a kid, and kind of discuss it as if it is this amazing option kids are exercising now, which I think we do see some concerns where there's more opportunity to go than kids let on based on what's showing up for them. But I think parents are coming in with a little bit more information and knowledge, for better or worse.
Knowing how much pressure kids are under these days, kids and teens, whether it's academic or social, most of the schools that I've worked with recently offer a certain number of mental health days for their students because that's the reality we live in. So how do I as a parent know, okay, shouldn't let my kid take another mental health day, and this requires some sort of intervention?
One of the things I always try to keep an eye out for is if you see your kid deviating from things that would be aligned with their usual kind of values or goals. So if suddenly a kid who is plugged in, they seem happy at school, they have friends, they have clubs, they're in classes that they really like, and then you see them retreating or unable to engage in those things, that's usually one thing I think to pay extra attention to. From a higher level, I think just generally, anytime day-to-day functioning is impacted, I think every family has to make their own decision about if a school has a mental health day policy and they got 5 a year. I think there's some parents who would say, we don't believe in that. We're not doing that. You got to just go to school. And maybe that's okay. If your family is like, sure, we'll support that. That's also fine. But if you're stepping past those and suddenly you're saying, grade decline, decreased time with friends, again, kind of pulling away some of those preferred, typically pleasurable activities, I think that's where me as a parent, I would get worried. I know with my own kids, I'm always paying attention to what is marked change in what they used to be able to do or want to do. If I'm hearing I don't want to do something that a week ago you clearly had love for, and suddenly you're claiming you don't care about it anymore, I worry about that.
That's interesting. And how normal is it for a kid to want to just stay home because maybe they're worried about a test? Like maybe they didn't study enough.
I think super normal. Like I remember being a kid when I was sick, and I was genuinely sick. There's certainly an opportunity where a couple of days into it, I would milk it and be like, one more day. I'm not quite well. And I would watch Price is Right and do whatever else, like I think most kids do. But there would always be that part of me that would want to get back and be bored and be restless. I'm not saying pick up the phone and call a therapist or worry about it if your kid's doing something like that. But again, if it's persistent and getting in the way of how they navigate in daily life, then it is cause for at least more conversation with them, which is usually the next step anyway.
You mentioned feeling sick, and earlier on you mentioned sometimes kids are reporting physical symptoms. And I know a lot of the families that I've worked with around this issue, kids and teens are having significant, whether it's headaches or nausea or frequent trips to the bathroom, stomach pain, and those physical symptoms are very real. They're clearly not lying about it, and they're happening every day. So how do you suggest parents handle these things knowing their kid is physically uncomfortable or feeling like they're sick, but really medically there isn't something going on there?
I think the thing definitely not to do is invalidate that they're feeling those feelings. Nobody wants to be told what you're experiencing physically is fake or it's all in your head. That adds shame to someone who's already probably experiencing a fair amount of guilt and shame or whatever other complicated feelings they're dealing with. But I think usually tying kind of whatever physical complaints are coming up to school's policy or wherever they need to be. If a kid's saying, I've got a headache or stomach ache, but they're not naming fever, diarrhea, these things that would typically prevent you from going to school. And then probably exploring and not in a way that wants to reinforce you're taking them to doctor all the time. If this is several days in a row and saying you're going to schedule a doctor's appointment, kids can go to school and have a headache too. But I think using some of that language of this sucks, you feel crappy. If you're not contagious, you should be in school, and here's why.
I like that. Sometimes People don't really understand that mental health can cause very real physical symptoms. So sometimes it's educating everyone in the family about that. And to your point, sometimes you want to get something physically checked out. And at the end of the day, we want to build that resilience and help families and kids understand you can have a headache and go to school, especially if you've seen a doctor. This is mental health related, and we would treat
Mhm.
that through mental health supports.
I think that that's so important what you just said, Beth. We all hold stress in our bodies differently, right?
Mhm.
So I know when I'm super stressed, I get stomach aches. So like I can totally relate to that. I'm curious, how does this look different for younger children, tweens, teens? How are those physical symptoms different if they are?
I think some of the physical stuff you're going to see kind of across the age range, especially in terms of nausea, headaches, stomach aches. I think in younger kids, we more frequently hear that is kind of the first thing discussed. A headache, I'm sick, I can't go. And in younger kids, you're likely to see more kind of overt emotional things like tantrums, crying, screaming, more intense stuff. 6-year-old feeling upset or sad, likely manifesting it differently than a 16-year-old who's internalizing and looking sad and depressed and kind of reserved. We see a lot of kids who are going slowly about the morning, not getting out of bed, requiring lots and lots of like a parent coming in and kind of shaking them and moving out of bed and moving about things more slowly. I think the older you get, the more opportunity there is to physically assert yourself and say, I'm just not leaving the house. I see that a fair amount at Compass where a kid's struggling and they're genuinely so anxious and overwhelmed. They're just not leaving the room despite having two parents hovering over them, calling them. I'm trying to talk to them on the phone. They just physically frozen or unable to move themselves.
If families are experiencing that, or maybe a lighter version of that, what are some tips or skills that they could start using in their home when mornings are tricky?
A lot of therapists more and more lately were using the phrase co-regulation. And I think just reminding ourselves as parents to keep ourselves as calm and collected as possible as a way to kind of model to our kids. I can be stressed out, but also kind of manage. So when we're checking in, reminding about going to school, trying our best not to like have elevated voices, yelling. It's extremely human and normal. I know you said in the intro something about mornings being these high energy moments. And I think if you're like me, I'm running out the door saying I got to get to work. I can't miss this meeting. And then I'm finding my blood pressure raising and yelling at a kid. That's not going to really translate well to them feeling less anxious. So I think trying to be as calm and neutral as possible. I think a lot of parents do it anyway, but setting timers and disengaging for intervals too. So if you're talking to a younger kid and saying, I'm going to come back in and check in 5 minutes and I want to see, your clothes on, teeth brushed, whatever. We do that in my house with basic morning routine stuff.
Yeah. And something that we were talking about with Dr. Levine on our previous episode, where she said if you're working on new skills in your household or on a new behavior plan, that you only really have to get 85% of it right. And so
Mhm.
just like reminding parents that you don't have to be perfect all the time. I know I've been there, raise my voice sometimes, or, you don't get it right every time, and that's okay.
I do think when working with therapists, sometimes parents get perfectionistic about going through some of these plans or suggestions. And if they think if they mess up one thing, it's like resetting the clock. And I like that 85% idea. You're going to screw it up. There's just no way around it, but you don't have to refresh and reset. I think a lot of kids have that mentality too, which is one of the reasons getting to school can be hard. It's that perfectionism and stuckness that happens.
Obviously, this plays out differently in every household, and it's going to depend if you have an adult who stays home all day or works from home, or you have multiple children that you're trying to get out the door, you need to get to work. That really adds so much stress. I wonder, though, we talked about the different functions that underlie the school avoidance, and I know that we intervene differently depending on what's going on. If a child is having severe panic attacks over social related or performance related things going on in school versus they're so low and depressed that they truly aren't functioning in any areas of life versus I want to stay home because when I'm home, no one's home and I'm going to
Mhm.
sneak and play video games. Can you talk us through the different approaches we might take based on what's going on underneath?
Right. If we're seeing like someone's home playing video games, they're not exhibiting any other signs of anxiety, depression, lower mood. We probably are thinking about like rewards and or consequences and some more old fashioned plans along those varieties. I would say that's not something I interface with a ton. I don't work with too many kids where that's the issue. Plenty of parents wish it was that simple. Typically, if you're seeing that more marked anxiety and panic related to going to school, especially if it's more on the social side. I think it's always tricky, but we do want to be doing everything we can to eventually interface with school, but then we get into it in a really slow, deliberate way. I think that's the common concern that we run into a Compass because our program is such that people aren't going to school for a while. We want to keep on the tip of a parent's tongue. Yes, there's anxiety. We might need to take a step back and figure it out piece by piece, but we're also not taking school off the table. So gradually exposing the things that are causing anxiety and doing that slowly and deliberately, but also building in supports, coping skills. That's usually very deliberate and slow. And you have to figure out from the kid what it is that's driving in the first place.
If a young person is avoiding school and we can't get them to go, what are we recommending to parents at home? And again, it will depend if a parent or an adult is able to be home at the same time as the child or not, depending on how old the kid is. What are we recommending that the kid do all day if they're not inclined or feeling up to necessarily just doing all of their homework all day?
Yeah, it's usually when we sound like jerks as therapists, because what I end up telling 99% of parents is you need to help the home environment be supportive, but not particularly comfortable if possible. So not having access to screens, creature comforts, things like that, because yeah, like Price is Right is cool if you're sick for 2 days with like a stomach bug, but beyond that, we don't want a kid who's already wanting to miss school because chemistry class is hard or they're having panic attacks to suddenly find home to be this very comforting, soothing environment. Having some of those creature comforts inadvertently reinforce being home is the easier, better, softer option, or just more desirable option. So usually for parents, I'm saying limit screen time unless there's like academics that they could be doing. So if a kid is at home occasionally, they can be doing some schoolwork while they're home. But, beyond that, I mean, it'd be pretty dry and pretty boring as you're also concurrently trying to talk to them and getting a sense of what's actually going on and then kind of exploring those paths. But usually first advice I give is cell phone, TV, all those things. I think we need to be taking that away and not having homes pretty dull and boring.
And just kind of to piggyback on Beth's question there, I mean, it must be incredibly stressful and difficult for families who are going through this with their children or teens, especially when they need to leave the house to go to work. I mean, that seems so hard. What do you do in that situation? Your kid won't go to school. You need to go to work.
Yeah, I mean, I think many different things. I mean, obviously, I think we see plenty of parents, and if they have the access, like if short-term time to be at home is possible, whether you can kind of flip to working remotely so you can be with your kid and getting other people in your life as supports. But I don't think many families have that luxury, and working remote today is not a thing. So I do think if your mornings are disrupted to that nature, that's usually when you kind of call in somebody else and like try to start to explore other professional options. I think you can do that on a morning or two, but very few people have jobs or bosses that are so supportive.
Yeah. When kids are having a hard time going to school, if it's that severe that they really are not able to go and it's affecting all aspects of family life and work, how hard is it to get them to, say, a program like Compasses? How does that transition happen?
I've been fortunate to not have to go through that process with my own kids. I talk to parents all the time about going through this. I do think programs like Compass or therapy for a lot of kids, even if it sounds scary and the idea of going into this new environment could feel very similar. And frankly, Compass looks like a school in a lot of ways. It can be very similar in the environment. There is potentially a relief in sight, at least coming for an initial discussion. Many are able to do that. I think day in, day out, things like coming to a program like ours, if they are, it's a very similar challenge. I mean, there's a reason I'm on the phone with parents pretty much every morning trying to provide guidance and support. They were struggling with school. Now they're struggling getting to Compass and like implementing a lot of the same strategies. I think it's extremely difficult. I try to be pretty candid with most parents I work with that this is going to be hard when you start to dig into this because fundamentally you're asking your kid to feel more uncomfort and more discomfort and more anxiety and more distress versus less. Like the easy thing would be to say, sure, stay home, watch TV, chill out. But what you're asking them to do is face their anxiety and work on stuff even more after they've already gone through a pretty rough period.
Knowing that a lot of the avoidance symptoms and behaviors, we often see it in particular after kids and teens have been home for a weekend and they've had comfort and not the pressures that come with school. Are there specific recommendations that families can try either the evening before or over the weekend so that they don't lose that momentum or they can help prepare kids for what is likely to come up in the morning if they're really struggling?
Yeah, I mean, having all the checks and balances in terms of kind of morning routine, all the things that could potentially be hiccups, basics of like having clothes laid out and backpack ready and some of the real fundamentals of you just have your ducks in a row to be walking out the door, I think can be really helpful so that there's not opportunity for potential excuses or curveballs in the morning. So just having some of that real basic stuff figured out. I do think it's not what to do, but what not to do, given this can be such a fraught thing in the morning time for families. And I think most parents are going to bed on a Sunday night thinking, oh my gosh, I hope tomorrow morning is not as bad as it was last Monday and the Monday before that and the Monday before that. Kind of not getting to too many conversations with their kids about what they're going to be attempting to do, kind of having it be matter of fact, like we're going to school, it is a plan tomorrow, but not getting into, I hope tomorrow's okay. Are you going to be okay tomorrow? I think that only inflames some of the anxiety, and people use the phrase Sunday scaries, but that kind of thing that's already in the kid's head. That's already there for sure. I mean, I think if you're a parent thinking, I hope tomorrow's not that way, end of the day, kids going to be thinking that too. And probably if they've seen it 10 times, they're pretty sure it's going to happen again.
What are some tools that parents can use to kind of work on that side of the equation for themselves? So if they are feeling really anxious about that Monday morning or the school pickup, what are some tools that parents can use to ease what they're going through alongside their child?
If there are multiple parents in the picture and you're co-parenting, I'm usually telling parents it's great if you have some sort of tag team system where you only have so much bandwidth to manage a certain situation. If you're able to get reciprocal support from the other parent, ensuring that parents are feeling aligned on approaches and strategies so they're going to deal with the kid with the exact same kind of messaging. I do usually advise to parents if there's anything that you would typically do for self-care or stress reduction while you're dealing with a kid going through something like this, don't pause it. And if you can double down on it, I think most therapists like the put your own oxygen mask on before your kid's on an airplane analogy, because, fundamentally it is necessary. You can't actively deal with kids struggling if you're completely tapped out. And so if you normally go for a run, do that. Do the basic self-care things you can do to keep your own resources a little bit more enhanced.
You mentioned earlier that exposure therapy can be a really effective intervention for some types of school avoidance. Tell us a little bit more about when we would employ that tool and how is that helpful? What kind of exposures would we be doing?
Yeah, I mean, it totally would depend on the school situation you're seeing. But for many kids, one of the first steps we do when we're talking about exposure therapy is gradual reintroduction to the things that were typically avoided and causing anxiety. So we usually talk to kids about developing a hierarchy, and you basically talk about what's the least anxiety provoking thing of the things that are anxiety provoking and the most. If talking in class is 10 out of 10, that's the most anxious thing I can do. And asking my teacher a question is anxiety provoking, but that's like a 1 or a 2. Kind of identifying those things through conversation, and therapists will guide this, but getting a sense of what those are and then slowly tackling those. Every day you're trying something new, or every week you're trying something new. It depends on the format you're doing it. And usually trying to build in safeguards of other folks to collaborate with in that process. So if somebody I'm working with, say, they're worried about a teacher's perception of them, asking a teacher for extra work or asking a teacher a question after the class has ended is really hard for them. We might want to work on prompting that exercise for the kid, but then also making sure they know that I'm going to check in with my school counselor and, they're going to give me a little bit of support. I'm going to talk it through with them so they know they have a safe adult in the building who's helpful in addition to that adult they were just talking to. For some kids, we might start really, really, really small. If getting to school in the first place was difficult, one of the first things I talk to families about sometimes is drive by the school on the weekend, go to the parking lot when school's not even in session, just be in the presence of this huge building that to them might be the scariest thing in the world. So really slowly facing the thing that is causing the anxiety.
I think on the flip side of exposures, my brain goes to accommodation. I'm not talking about necessarily formal accommodations
Right.
like a 504 or an IEP, although sometimes those things are helpful and necessary. I know there are ways to partner with schools, right? To either in the short term or for a while. So, for example, if someone is avoiding school because they're having significant anxiety around being called on in class unexpectedly, there are ways to work with school supports, whether it's a counselor or the teachers themselves, to ask that, temporarily child not be called on unless they raise their hand, or give them opportunities to provide written responses or just present to the teacher. How would you recommend families explore with schools what might be available either to ease a kid back into school if they've really been avoiding, or preventatively if it's still in sort of minimal stages.
Yeah, I mean, I think typically first pass is usually reaching out to their counselor, advisor, whatever like the name for that role in a school is, but usually counselor. And kind of making them aware that you've noticed some challenges with anxiety. And obviously, if it's impacted attendance, the schools may be aware of that already. But my experience, plenty of schools, the counselor has few hundred other kids on their caseload and they're not necessarily that aware. So you got to make them aware. And I think making them aware there seems to be an anxiety concern here or something related to their mood versus this kid's ditching class, so kind of putting some context to it. And then some schools are a little used to relatively feisty parents who might be asking too much of them. So I usually suggest entering gently and asking kind of what is possible. And then many schools are very glad to give, like you said, informal accommodations. So if it's been a rough couple of weeks, wondering if can we have a conversation with Mr. Blank and figure out, are they able to, step out for a sip of water? Can they maybe talk about the presentation kind of more informally. And then there are opportunities to, of course, if you're noticing persistent concerns and if you're working hand in hand with a professional, asking what it takes to look into a 504 plan. So there can be some more formal accommodations. And there's good resources online for that. A lot of extremely smart, well-versed parents are like, I don't know what a 504 plan is. How do I ask for one? How do you do this? And there's form letters and you can send it to the school and then they have a certain amount of time to respond. We often work with parents on that, kind of at least initiate that conversation. A worst case scenario, the school assesses and says, we're not seeing the criteria, but it's never wrong to ask the question. But I think, again, just reaching out to that counselor is a starting point. Again, I would suggest going in gently.
I think that would be really helpful for our families to hear. How often does a single event, more or less, lead to school anxiety and avoidance versus there are things that have been happening for a long time that lead up to not going to school? Is that something where parents could start, maybe their child isn't totally avoiding school now, but are there things that they could start doing?
I think every parent already struggles with that. Like hindsight is 2020, and they're like, "Oh, when they were 6, they were showing all signs of this, and I didn't do anything about it. And should I have gotten a therapist earlier? Should I have talked to them about that kind of stuff?" No, I mean, I feel like most parents I talk to almost wish there was something you could put your finger at and say there was one event, there was a thing, we know this happened, and now we can address it. I think it's pretty rare, at least in my work, that I'm seeing a large-scale traumatic, stressful event happen, and now the kid's not going to school. Of course, that does. I've worked with kids where there was something very public or something very difficult in the school, like a breakup or any number of kind of big social fallouts that can lead to some avoidance. But I think the stuff we see most of the time is, unfortunately, a hell of a lot more subtle and gradual, and it has more to do with what's going on internally than it does to something external you can point your finger at.
All of us therapists like to say all behavior is communication. And most behavior is the communication of an unmet need. And so that just takes us back to the why. If there is bullying happening, and that is why someone is avoiding school and having stomach aches, we're going to intervene very differently, but we need to understand why. Maybe that child is afraid to tell us, or perhaps there is a learning or processing or other issue that neuropsych testing is going to help us understand, and that child learns differently. And maybe needs different accommodations or teaching styles. And so, again, there are so many reasons why a person might feel anxious going to school or avoid going to school. In addition to all of the ones we've mentioned, that has to be the first step. And depending on what it is or who the child is, it's not always easy to communicate, and they themselves might not understand.
I think I talked to a lot of kids who they almost feel kind of betrayed by what's going on because maybe school was this beautiful place for them for so long. And suddenly they're like, this was my place and now I hate it and I can't point a finger to it. Sometimes that's kids who are also not necessarily dealing with school anxiety, but it's more like burnout and they've been just kind of grinding and grinding and grinding. And that might be a little bit of a different thing. But I think it can be very confusing. Why is this different? I don't know. I think when I talk to my 8-year-old who's often pretty anxious, they're like, what are you worried about? She's like, I wish I knew. She doesn't have words for it. And it's just kind of only adds to it.
I mean, there's also kids with perfectionistic tendencies, like the kids that you just described, where school was where they were excelling, oftentimes without even having to try. And all of a sudden, the inability or the need to do something completely perfectly is so overwhelming and grows to the point where they're totally paralyzed. They can't turn in work. They are rewriting and not meeting deadlines and so afraid to not get it perfect that they're completely paralyzed. And especially once you get to the high school level and beyond, missing a day of school or a specific project causes you to fall behind, and then you just see it snowball so quickly And I think that can be really overwhelming for kids. And then that gets scary for parents. We've worked with a lot of families where, I'll be honest, your kid is really struggling to the degree that they're not able to get to school and turn in their assignments. So we start to talk about maybe it's time to ease the course load. But we've been on this track for so long that we are going to be in all AP classes, and that is what we know this particular child is capable of. But the idea of kind of veering off of that course temporarily or not is so scary to people that the pressure stays. And that's not a judgment at all. It's just so hard and it impacts the whole family.
Yeah, I think, like you said, not judging a family, but having a conversation of there is a recontextualization of your sense of your kid as a student, like your family as a family in a school. And it is fundamentally going to work towards their advantage if you do maybe take some of those what feel like big steps to drop the class level or whatever else. But ultimately, you'd rather passing grades on a student who attends school than one who's failing their AP level classes or not even attending those classes or having even bigger concerns arise.
There really are things, and again, it varies school to school, but that schools can do, whether, like you said, Adam, informally or formally. I know we've worked with schools where morning is so hard and getting a student to school is so hard, regardless of the reason. And also, on top of that, their first class of the day is their most challenging and least favorite class. Like, is there a way to work with the school to change the schedule so that it's something they can ease into or enjoy? The social anxiety is so hard, or there was a past bullying situation, and so lunchtime is really hard. Is there a way to have a friend in lunch or an alternative location for the rest of the semester until the schedule changes? On the one hand, that can feel like accommodating. On the other hand, it's a step in the right direction. It can be helpful to partner with schools, and there's a lot that can be done creatively.
Yeah, and I think what you're saying about expectations is so important, right? I think we've talked about this in a previous conversation, Beth, where it's like, as parents, we have expectations on who our child's going to be, how they're going to show up and perform a lot of the time. And that's not available to the child, or that's not who they are. Or like, we just kind of have to shift our expectations as parents a lot of the time too, to make space for the child, right? And where they're at in that moment, or, whatever they need, to an extent, of course, without being intimidating and all that.
I think the trickiest thing, and I know like every parent I talk to, that balance of how do you provide support, but also encourage and push and not accommodate. It was like, how do you hug somebody and kick their butt at the exact same time? And that was really, really tricky because you don't want to like let them off the hook. You don't want to rob them of the gift of resilience by accommodating too much. They need to face distress, but also like if they're in hell 6 hours a day in school, we got to give some ease somewhere. Like that's just the only way you can do it.
Are there times when a traditional school environment maybe just isn't the right fit for a child or teen? My kid's pretty young. He's only 5.5, but he was in one school and he was going, but he really was not enjoying it. A lot of like, I don't want to go to school. I don't want to do this. He transitioned into a different school and it's been like so easy ever since. He loves going to school. It's just a different type of day. And that's only one example of one kid in my case. But I'm just curious, are there times when a school environment isn't the right fit and maybe a shift can happen?
I mean, every kid has unique learning, social emotional needs. There are some schools where the education there doesn't match somebody's specific academic needs or interests. And I think all sorts of factors are potential there, right? Like I know in Chicago, there are kids who are in quite small elementary schools and middle schools. And then when they go to high school, they're looking at potentially like a 5,000 person high school, and an environment like that could really, really be different for them.
Yeah.
And that same environment could be amazing for many, many kids. I think plenty of time you have to kind of look at the match. And I think back to the conversation about partnering with the school. I don't think anybody's actively interested in taking my kids in 10th grade. I want to change high schools or whatever the case may be. That can be really tricky. But after exploring what accommodations and supports can be available in the school and working with other folks to help a kid be successful in that school, if you're consistently making attempts to adjust to that environment and help support, and you're still seeing struggle, sometimes there's nothing wrong with that school. It's just maybe a hard fit for that particular kid. And I think plenty of families who do explore other options with support, and they do find a sizable difference. In my experience, I'm rarely excited to hear somebody doing online school or virtual school where they're not having those more traditional social interactions. But there are probably some kids and families who would disagree with me, and that has worked for them because that met the needs they had.
Yeah. How does a child or a teen being neurodivergent factor into this discussion? And I know that that's an umbrella term, but if they are neurodivergent, how does that change the conversation about what the family or school might be seeing with respect to school anxiety and avoidance, and how like a plan could be for that child?
Yeah, if a child has like diagnosed say, autism spectrum disorder or neurodivergence, usually that's obviously very important for the school to be aware of so they can look at structural accommodations and supports. But say if it's not diagnosed, I think I've seen plenty of kids where teachers' experience of a young person or the school's experience of a young person might be quite a bit different than the kid themselves. And certain behaviors could seem like they're disinterested, they're not being engaged. Behaviors that, don't match up with the expectations in the classroom can read very different than if they had a better understanding of what the person, was navigating from a diagnostic perspective. Typically, if, a young person is neurodivergent, they're in a school and in a world that isn't, and the expectations are mismatched, and it's like profoundly confusing and unfair for them.
Sometimes medication can help. How do you know whether it's something to look into when it comes to treating? I guess school avoidance is the symptom and not necessarily the diagnosis, but in what ways can it be helpful, and how do parents know when it's time to consider?
I hear it from psychiatrists all the time. If traditional therapy and other interventions are not working for a sustained period of time, if like you're going to a therapist once a week or you're going to a daily program and you're not seeing any change, I think it has to at least be a lever you discuss. Plenty of families have reservations, concerns, philosophies about medication. If therapy's not showing any dent in the progress you're looking for, I think at least it's the next conversation. I always advise parents, like, be as transparent as you can be about your reservations. No doctor is offended if you say, hey, I have some thoughts about this. Like, they're used to that, and you should speak candidly about your reservations entering into those conversations if they're present.
Britt brought this up earlier that oftentimes, in the same ways that kids might be really anxious or refuse to attend school, they might feel the same way about going to see a therapist or taking a medication or showing up at a program like ours. What can you do? I mean, if I have a 3-year-old who's refusing to go to preschool, I can pick them up and I can put them in the car, and hopefully by then I can offer them a treat. But as kids get bigger and symptoms of anxiety and depression increase, can't just do that. Can't really make a teenager do anything.
I think the older they get, the more tied they get to things like phones and technology. So like that's a natural starting point. I think certain privileges like cell phone and social time and time out on weekends, like if we tie those to, those are things that we get access to because we're functioning and we're doing all the other things that are important. Maybe those are things we don't get access to if we're not. And it's not to punish, but it's to provide an opportunity to at least look into support for the thing that's a clear need. I think we never want to shame or make a kid feel like they're being punished for having depression or anxiety, but letting them know we can't provide extracurriculars and incentives if we're not able to function. So I think for many kids, I'm talking to parents about like, they might not get the phone or they might get to do these things if they at least don't go like talk to somebody. Let the professional be the person who says, mom and dad are over the top here. Like, this is too much. They're exaggerating. This is no big deal. At least talk to somebody like a therapist who check it out and then go from there.
You mentioned earlier, a lot of times when kids are refusing to go to school or refusing to go to a therapist or program, they're thinking about the future and the what ifs or whatever misconceptions they have in their mind about what goes on in therapy or those programs. And it reminded me about how that's what it's like when they're thinking about going to school and feeling really anxious. And one of the ways that we often suggest that parents try to help in the morning is to not focus on school, but just the next small thing, the next small step. So it can be as small as taking the blankets off the bed and putting your feet on the floor, or hey, let's get up and brush your teeth. Like one thing at a time. We're not even talking about getting out the door to school. We're talking about getting through each step of the hygiene routine and eating some breakfast and not focusing on that end result. That's what's causing them a lot of anxiety. And it sounds like you're saying that can be helpful for getting them to go to a therapist or program or other undesirable activity as well.
I think any baby steps, I think a teenager would be annoyed by that phrase, but yeah, just incremental steps. And each part of that is huge. And if you're somebody who the idea of even getting out of bed feels difficult, it's like brushing your teeth 10 minutes later is impossible in your brain, but then you do it. The next thing potentially leads to the next thing. And then I think, right, it's the parent's job not to be rushing that process necessarily, but still encouraging it.
I'm wondering, Adam, if you could share, of course, without any identifying details, just maybe a story of a family that you've worked with. They were having a really hard time and you really did see great progress and they were able to make some big strides with treatment. I'd love to hear about that if you're willing to share.
Honestly, not to say families blur together, but there typically are kind of these thematic things that pop up with different families where I don't have a particular success story. Holy cow, that was the greatest thing I ever saw a family do. But I do think we're talking earlier about kind of making adjustments to your expectations of your kid. And I think that really resonates because I have seen so many families, like my kid was this kind of student, this kind of athlete, and this kind of whatever in school. And seeing families with grace not give that up, but just kind of shift their perspective and understanding of what success means for their kid. And the fact that several families I've worked with, like their kids still going to school, they're with friends, they're doing things academically still, they're still engaged in extracurriculars, but it's just dialed back or it's less intense. And the parents are able to kind of shift their expectations of the kid and still congratulate and praise that and see that as victory. I have all sorts of expectations for my kids and I'm cheering for them and I'll be disappointed, I'm sure, if like, oh, you don't want to do this thing that it's important to me. I think seeing families cheer for something that they weren't expecting to be cheering for is huge. I think cheering for just like going through treatments and navigating anxiety to see like a dad who's just as proud of his kid for doing exposure as they would be for like some math test or, sporting event, I think is huge. And like really praising that is just as brave and just as strong as any other accomplishment they might have.
I'm thinking about on the days that you have been successful, like what was the recipe there and how can we recreate it? And really reinforcing the positive while understanding that, just like you said, Britt, Dr. Levine mentioned that 85% consistency is a huge success. There will be lapses. There will continue to be hard days. And it doesn't mean that we all need to start spiraling about how we're back to square one. And okay, but we know that you've done this before. We know that there's been success before. That means we know that you can do this. That means we know that we can do this. We're just going to keep at it and keep
Yeah.
trying.
Yeah. I think many parents I'm talking to in their first week at Compass and they're like, oh, it's been a good few days. Like, I'll talk to you Tuesday morning. I plan to hear from you about 7 a.m. I expect your kid might be having a hard time. This is normal. It's going to be okay. Enjoy this and life's going to happen. I think not letting it be so discouraging that this is a forever state, but every single person's going to take a back step. That's just the way it works.
No child has refused every day of school for their entire life. So reinforcing that you've done this before and you can do it again can be really helpful. And reinforcing that to ourselves as parents.
Yeah. And I think that that also speaks to, as parents, how we talked about this earlier, but how our energy can really help. Like we live in a time where there's just so much fear around parenting and we're bombarded with so much information and we're so worried that if we do one little thing we're going to wreck our kid or like one little decision or one little interaction is going to be a big deal. And I think that kind of plays to the fact of it doesn't have to be perfect. What you're doing doesn't have to be perfect. Also, to what Adam said earlier, missing a few days of school here or there can be normal. Wanting to stay home and watch your favorite show can be normal. When does it merit paying a little closer attention?
Yeah. And we didn't talk about it a ton, but I think I've always leaned towards like transparency with kids, whether they're my own or kids I'm working with. Like, we're trying this. Like, this is what I believe will work. This is what I believe is helpful. This is what I believe is the problem. But you tell me if I'm wrong. I'm not saying I'm clueless here, but gaming yourself as a human being who's trying to figure it out. And kind of, I think a lot of kids respond to transparency and realness and they can tell. I think they know. And I think being transparent of like, guys, this is like what I think it is. So I'm going to try this with you this morning when we're going to school. And if I'm getting it wrong, like tell me and I'll change course. I think being a little bit vulnerable, but not like making your kid stuff has been useful for me.
I love that. I love that idea of like, hey, I'm gonna try this. Let me know how it goes.
I remember like my parents acted like they knew everything. It was like, I know you don't. Like I can see
Yeah.
it in your eyes. Like it's just
The
so
veil
clear.
comes off eventually,
Yeah,
anyways.
yeah, yeah.
I fear-based parented in sort of the reverse way. I remember when I first started treating and learning more about school anxiety and school avoidance, my kids were a lot younger. And I was so worried that that was going to be my kids that I sent them to school sick. And I remember I got a call from school that one of my daughters was itching her eye and it was looking a little red. And is it pink eye? And I was like, no, it's just allergies. She's trying to get sent home from school. I refused to pick her up. I was so worried. I mean, I was spiraling about the future and her becoming a full-on quote unquote school refuser. Finally, they said, you have to come get her. Her eye is red and she's itching it. I brought her home. I was like, nope, this looks like allergies to me. I brought her back to school. Long story long, I ended up having to pick her up again, took her to the doctor and she had pink eye. So like sometimes you were correct.
I may have 5 books about childhood anxiety coming to my doorstep later this afternoon because my kid made one comment about what happens when you die. I'm anxious about dying. I'm like, well, you're 6, that's normal, but it's like, let's just get ahead of this.
Oh my gosh, my 5.5-year-old is asking those questions as well. And I'm like, is this normal? Where are we going with this conversation?
That's when I wish I had a better answer than I don't know. But yeah.
Yeah. I'm like, oh my gosh. We're mostly just parenting in the dark. And it helps to talk about these things, right? That's why we're here at the end of the day. Because you only know what you know until you talk about it and learn more, right? Adam, if a parent or caregiver is listening and they're feeling super overwhelmed, they're really unsure what to do next, every day is just really hard, what would you say to them? Just like a little takeaway.
Man, I hate to say things like it gets better, but I mean, like you said, Beth, there is no kid who has refused school every day of their life. And I think this is a problem with the solution. There are resources, there are people who understand, and it's going to take hard work. There is an end in sight for this, and it's going to be relatively difficult and potentially miserable for you as a parent because like you do have to carry a lot of the burden, but obviously it's worth it, and it's potentially not as mystifying as it could seem.
It is so challenging. It's called school refusal, or has been historically, because it looks and feels like a choice in behavioral. But I think all of us are aligned that kids are doing the best they can in the moment. And we know oftentimes that they can do better with the right supports. This is hard and there is hope for this. And I think just to underscore again the idea that all behavior is communication. So we need to figure out when kids aren't able to communicate or don't know what they're trying to say, how we can help them untangle that. But this is a tough one. This is one of the harder things to treat, and we see every day successes. It sounds very cheesy, but there is hope and there is treatment, and it's a bumpy road for this one.
If you're worried, if you have concerns, just start the conversation, right?
Yep.
You could call.
Conversation with your kid, conversation with the school supports, conversation with an existing or potential mental health support, conversation with a friend. Just start and things will fall into place. There's so many things out there that can help sort this out.
This is enormously complicated. Like you said, Britt, just being curious and then starting the conversation with whoever's in your orbit, whether it be your kid first or your friend next to you at a soccer game or whatever, because you need to talk about the problem your kid's going through. I think that's the best way to start.
And the best cure for a true stomach ache is The Price is Right. As we wrap up today's conversation, one of the biggest takeaways is that school avoidance is rarely about a child simply not wanting to go to school. More often, it's a signal that something underneath the surface, anxiety, social stress, perfectionism, is making the school day feel unmanageable.
When we understand that behavior is communication instead of defiance, it changes how we respond as parents and caregivers. Then we can start asking different questions like, what is my child trying to tell me? How can I best support them? And what might I need in order to do so?
Remember that progress usually happens in small steps. Sometimes success is not a full day of school right away. Sometimes it's getting out of bed, brushing teeth, and walking through the school doors. Those incremental steps build resilience over time.
And parents, we know how important it is to take care of ourselves in the process. These situations can be incredibly stressful for families, and it's okay to ask for help, whether that's reaching out to your child's school, a therapist, or a parent who's been through something similar.
If you're navigating school anxiety in your own family, remember, you don't have to figure it out alone. Starting the conversation can be the first step towards support.
Before we go, maybe this can be your reminder to step outside today, take a deep breath, and check in with the people around you and with yourself. Sometimes the smallest pause can help us reset and connect with what really matters. Thank you for listening to You Only Know What You Know. We'll see you next time.